question we frequently get asked when people are booking in for their vein treatment is, when can I drive after my vein treatment? Well, it depends on the treatment you're having. Now, if you're having the VNUS procedure, that's where we use a medical superglue inside the vein. You can drive yourself straight away. That means you can drive to the procedure and home, or back to work even, after your treatment. That's because we use very little local anaesthetic, in fact usually just one small local anaesthetic injection per leg, and there's no bandaging or stocking to wear afterwards. So I've known people who've driven themselves to the treatment and then driven back to work or back home afterwards. There's no restriction on driving straight away. Now, if you're having sclerotherapy and it's your first treatment, I usually advise that you don't drive straight away. You have somebody bring you to the clinic and drive you away. And the reason for this is that very rarely sclerotherapy can cause quite a bad headache, and it can bring on a migraine with some flashing lights in front of the eye. It usually only affects people who suffer with migraine only. It's never permanent. It only lasts usually just a few minutes, an hour maximum. But I wouldn't want you to drive if you have a blinding headache and if you've got some visual symptoms. And for that reason, on the first occasion, I say have somebody bring you to the clinic and take you home. Now, if you've had sclerotherapy and you've had nothing like this, you've not had a headache or any visual symptoms, then I'm very happy for you to drive yourself to the clinic and drive away, both for foam sclerotherapy and after sclerotherapy for thread veins. Now, if you're having an endovenous treatment, such as laser or radiofrequency, I don't advise driving straight away after the treatment. I recommend that you have somebody bring you to the clinic for your treatment and then drive you home. And the reason for this is that we use typically quite a lot of local anaesthetic, and we do often put a firm bandage with a stocking over the top. This doesn't inhibit your ability to walk. These treatments are walk in, walk out, and you will be able to walk. It causes no weakness of the leg, but I wouldn't feel comfortable about you driving home after an endovenous treatment. The next day, if you feel comfortable and if you're able to do an emergency stop, then you can drive. Now, the important things here are that you are able to do an emergency stop. Imagine a situation in which a child ran out in front of you, through no fault of your own, you hit that child. Would you be able to put your hand on your heart and say, yes, I did an emergency stop, and had I not had the treatment, I wouldn't have been able to stop any more quickly? You might have to justify that to the police if they were called. The other thing you need to be sure about is that your insurance, your car insurance, covers you for driving very quickly after treatment. Just double check with your insurance company, tell them what treatment you've had, and see if they have any particular guidelines. So there you are. That's my advice about driving after vein treatments. I hope you found it useful. Don't forget to subscribe on the link just here. That way you'll be amongst the first to see my next video. And I'd love to hear from you if you have any comments or questions. Just leave them in the link below and I'll get back to you as soon as you can. Thank you for watching my video.